Welcome to Place by Design. You're watching a podcast dedicated to the exploration of places in which we live, why they matter, and how we plan them. This is recorded live in Southwest Michigan, and I'm your host, Garth Woodruff. Okay, so this week we bring you Guy Miller, who's an epidemiologist at the Berrien County Health Department. Welcome, Guy.
Thanks, Garth. It's good to be with you virtually.
It is good to be with you virtually. You're the only guy in town that I really actually have to do a Zoom meeting with, because all the rest of us were really just pretty much getting together anyway. But because you're the epidemiologist, it would look really bad for me to actually meet up with you and give you a real interview.
Yeah, that would look really bad, and we should talk about that.
Okay, maybe some other time. All right, so as an epidemiologist, you generally take people's blood, right?
No, but I did do that once.
Okay, no, I'm kidding. I know it's skin disorders. So you mill around the county and you look at skin?
No, not at all. Never done that.
Never done that. All right. So then help me understand what an epidemiologist is.
So, I mean, you were kind of close, Garth, when you thought epi. That's a good root word to break down. But think of epidemic and not epidermis. We think of here. And a lot of people do just abbreviate epi. And we get that all the time, actually. I don't know if I've mentioned that to you. People are like, oh, you deal with skin or something like that. No, so epidemic. So we study the disease kind of burden in a community and its geographical distribution throughout an area. So since I'm the epidemiologist for Berrien County, obviously I'm studying diseases and how they're kind of spreading or where they're at within Berrien County. And this is everything from infectious disease to chronic disease. So talking about diabetes, talking about heart disease, and talking about, I don't know, something like COVID-19.
Really? See, I think COVID-19, I think when mosquitoes sting too many things and people start dying, then there's somebody like you who mills around and tests deer and stuff like that. I don't think about overeating or not exercising as an epidemic, but I think it could be. All right.
Yeah, that's debatable about using that term epidemic when talking about obesity. A lot of, I'd say more of what I do is based on public health and not necessarily epidemiology to that extent. But there is some debates about, I'm not going to get into it, about calling it an obesity epidemic or the opioid epidemic.
Oh, right.
So non-infectious diseases being termed epidemics are, not always the kosher way to talk about them.
But really the truth is that nobody before March of 2020 knew who Andrew Cuomo were or epidemiologist. And now the whole entire world's talking about all y'all. Everybody's going to know what an epidemiologist and who Andrew Cuomo is probably for the next 10 or 20 years. You're a little bit of a celebrity now. That's what's happening. But I've got real questions for you. I've got heavy questions for you. I've got questions you need to prepare yourself for. All right. So I teach a class at the university called Environmental Leadership. I'm actually going to use this video to pollute their minds just a little bit, because this week we're talking about ethics and values and things like that. And the whole COVID thing has become just an enormous cesspool of ethical conversations. When I discuss it with colleagues in town, colleagues at the university, so on and so forth. And it just so happens that at the early onset of this, when it was just breaking out on the West Coast, I don't know if you remember or not, there was a cruise ship stuck off the coast, and they wanted to come into Oakland and get some people off. And of course, college students, they don't read the news, So I used this whole story as this fictional ethical decision that they had to make, right? You're the president of the United States. There's a cruise ship off the coast. Do you let them in and then have these people infect the population of your country that you're supposed to be protecting? or which is, yes, you do, right? And then, or do you leave them out there and you let them all die? And no, you don't do that either. And it's like, really, at the end of the day, this epidemic has brought up multiple different layers of ethical decisions where, no matter the choice you make, if you're in that position, someone's going to die, right? Which
Yeah.
is which is really why I'm glad that I'm not in that position at all. So this give me a minute to set this up. So because of my role also at the university when it comes to environmental design and landscape design, I dialogue with the community all the time. And a lot of the leadership, they're reaching out to me and grumbling, Governor Gretchen, she shut us down. We can't work anymore. It's an economic problem. It's killing me. And then they've got these like posts that they post where it's things like Michigan.gov has this aging service site where it talks about, like, in this epidemic, there are things that you can do to help the people that really should be staying inside, maybe the older populations. You can go and blow their leaves and mow their lawns and do that volunteer work. And then the landscapers post that and go, wait a minute, so we can volunteer to do that, but we can't work to do that? And then, of course, they post pictures like the front of Costco where there's like 50,000 people standing in line, and then some dude on a riding mower out in a field all by themselves. And it's become kind of an interesting dialogue amongst myself and some of my colleagues in the community about the dynamics of this, because they're really concerned about their businesses and the economy of things, right? And we'll get to the economy of health here in a minute, but they're also very aware of the reality of the death tolls, and things like that. And they're trying to balance that. Before Governor Gretchen actually put her foot down and said, no, landscape companies are not essential business, they were divided on that. Some were like, what kind of a guy am I to have 5 trucks go out tooling down the road when we're supposed to be staying at home? And so to me, I'm actually kind of glad that she kind of put her foot down and just settled it, because it probably squashed some local rifts between different companies. And she just said, don't do it. And it made it easier, although there's a bunch of them that are staying up late at night and sweating. And you and I, we've worked together in this community on like food availability issues and things like that. And you and I both know that economy correlates directly to health issues. There's kind of a correlation between the two. Matter of fact, I've got some statistics that blow my mind. So this is an opportunity for me to grumble a little bit. I go online and I look at daily reports on infections and deaths, right? So like right now, the U.S., I had to do the math myself, but right now the U.S. is averaging around 2.9% deaths per infections. In New York, it's 3.6%. In New Jersey, it's 2.4%. In Michigan, it's 4%. And in California, it's 2.3%. And I don't want to be a negative Nancy, but I mean, there has got to be a reality that the economy of Detroit, right, and the economy of the suburbs of New York City are two different economies. And when we see death rates increase, it's not because doctors in Michigan are stupid, it's because of the imbalance of things, right? So you and I both understand that the economy plays into health, right? You and I both also understand that if we have this interview face to face, we jeopardize multiple layers of people that we come into contact with. And the question is how do you strike that balance? So from your professional perspective, how do you strike that balance?
Yeah, and this is the area that a lot of leaders, not just in the United States but throughout the world, are trying to battle. And it's almost like the supply and demand ideas of how you retail things and how the economy works, right? Is how many people have to get this to really limit exposures, or how many people like in your community have to be suffering before you can actually start making a lot of those decisions about to limit things and stuff like that. And the more you limit, the less, interaction people are going to have at place X, but they might, have more interactions with each other at another place. So your question about, how we do this, I don't think there is a perfect solution. There's no silver bullet for how to do this. You kind of have to play it by ear and figure out who is most at risk. I think that's a very important thing we have to identify immediately. And looking at all of this data, it is almost scalable, Garth. From 80-year-olds are at a higher risk than people who are 70, and they have a higher risk than people who are 60. So it really is like age plays a really, really important factor in here. And, if you look at like what happened in Seattle, Washington, where they had like a nursing facility attributed to most of their cases and definitely most of their deaths in the early outbreak of this. And all that was saying is that this virus got into an extremely vulnerable population. Unfortunately, I can't speak to much about who is dying in Detroit area or who is dying in New York areas, but ideally, idealistically, if you have an older population that gets infected with this, their crude death rate is going to be higher versus a younger population who gets infected with this. We know about 70 to 80% of people who get infected with COVID-19 will have no symptoms or maybe some slight symptoms that really aren't diagnosable for COVID-19. Maybe it's like a slight cough or something like that. So with that being so high, it's really hard to know if somebody's got it or not, which I think drives us in this direction to make very, very broad, sweeping movements of, what's essential work and what's not essential work. I think the new masking criteria that we have out is pretty directly correlated with that. Is the CDC recommends now, if you're ever going out into a congregate setting when you meet with all your associates, you guys should all be wearing masks. And the mask is not to protect you, a healthy person. It's to protect a person who might be infected. I don't have COVID-19, but saying I did, if I had COVID-19 and I put a mask on myself, we're always putting the mask on the sick person. Like, this is still the same thing we're saying. Now we're saying everybody in the community might be the sick person. So let's put a mask on those people.
It's a total flip of the mask concept. Like, it was always like, if you put a mask on, you're basically jealously trying to protect yourself. Now, if you see someone in the store with a bandana on, whether they realize it or not, it's probably one of the most altruistic things a person can do, because what they're doing is saying, I really don't know, but what I do know is that if I am affected, my breath, my spit, all the things that come out of my face that I don't think comes out of it could infect everybody else. So now the masks have completely flipped their purpose than they were like even a week ago. It's
no, I think Garth, I think our misunderstanding was before that. I think what you were saying is flipped was our misinterpretation all along. The whole time is, if you have a nurse X going into 4 different people's room, one of them has the flu, and nurse X picks that flu up, and now she's going into all those rooms, she's going to spread it. Like that's the nurse is going to spread that.
So then what you're telling me is that even wearing masks is part of the ethical conversation. At one point, we saw it as something that we were doing for ourselves, and now a mask is something that we're doing for everybody else. But what you're saying is that's really how it should have been from the get-go. We should have been thinking about protecting everybody else the entire time, because if you're the nurse that picks it up, the last thing you want to do is walk into somebody's room and spread it to 5 different rooms.
Yeah, that's the idea that we've been practicing, and it makes sense. But now that we're in this kind of like community spread type of situation, we're assuming that anybody could be spreading the virus now.
Right.
So that's where the recommendation comes to mask.
So let me ask a couple of questions here. Who in our community makes the decisions that trickle down such large mandates, like don't go to work or don't go to the store, one person in Meyer, or who in our community makes those decisions? Is it local government? Is it state government?
So right now we're acting under governor's orders. In Michigan, Governor Whitmer did declare the stay-at-home order. Obviously, a federal order could have came anytime sooner, but now that the state has decided that this is what we're going to operate under, that is what we're operating under. Local does have, we could have made that declaration a long time ago. Our health officer does have the ability to court order you to stay in exactly where you are, right by that plant in that house.
In my chair.
So they could do that. If we know that, for example, somebody with tuberculosis, I think this is where a lot of this comes from. If we identify you, we know you have tuberculosis, and we know you're an imminent health threat, we have the ability to isolate you. Isolation, symptomatic,
Right.
quarantine, asymptomatic. Yeah. We have the ability to isolate you in your home with a court order. Now, we don't like to do that a lot. We would much rather say, Garth, we really, really strongly encourage you to stay home.
Right.
What could we possibly do that would help encourage you to stay home? And that's kind of the way we go.
Did you have those conversations at the health department? Did at some point before the governor said, let's bring down the hammer, did you guys kind of talk? Because our county, so as much as everything's on the east side, on the west side, our county is the county that is blossoming, right? And I'm quite sure that it's from the influence from Chicago and the fire that is burning and blowing over this direction. Did you guys ever have that conversation, or did you not have to get to that point?
Yeah, so when those broad brushstrokes were made was when the east side of the state had their first cases. We didn't have any cases at that point. So no, we were not in a position that we were ready to start canceling schools, or we were ready to start telling everybody to shelter in place. One of the metrics that you're using, Garth, to evaluate this is the number of cases. I can tell you right now, we're going to have more cases than probably Kalamazoo, because Kalamazoo's testing ability is not as great as ours. We have an awesome relationship with our hospital system, who has the second biggest healthcare system in Michigan, which is Spectrum Health. We are able to partner with them to do some testing, and it has led us to this ability to test people who we think are going to be COVID positive. That's the idea.
It's not Chicago. It's just that we've got a really awesome healthcare system.
Yes, but it actually makes us look like we have a really bad healthcare system, doesn't it? Because we're so good at testing now, we're able to find more positive people.
The healthcare system's going to get trounced in this, even when they do it right. So here's another question. Is there like a list of things that somebody who's in the position, say your who's the health official? Is it Nikki? No.
Yeah, she's a health officer.
Okay. So is there a list that Nikki has that says, once these are all checked off, I'm shutting the whole county down? Like what drives some of the decision making? You're Governor Gretchen, and you've got to decide, do I shut down our economy, which in Michigan has not always been great. We've had some tough times with unemployment rates. Or do I shut down homes and save bodies? How do they make that decision? Is there anything that or is this just completely driven by the individual who is in that position?
Yeah, so I hope in democracy we never have the point where it's just completely driven by the individual. We all have checks and balances. We all have people we can consult with. Gretchen Whitmer has Dr. Janae Caldoun, who is her medical officer, so she is able to speak closely with her. She has the ability in the Michigan Department of Health and Human Services to consult with groups of epidemiologists to get their inputs on situations and things like that. However, this situation has so many moving parts. This is a national pandemic, right? We have never had one of these in my lifetime, and we'll probably never have one again in my lifetime, let alone like your kids, who are, granted, maybe 10, 20 years younger than me.
Right.
Probably never have one in their lifetime either.
Nope.
These are very rare. They don't come along, but we do plan for them. We have pandemic flu preparedness plans. Long-term care facilities have those plans. Universities have those plans. So we have these plans. They've just got about 2 inches of dust sitting on top of them. So a lot of it was, dusting these out and trying to go down this checklist of where do we go, when this happens, when this happens, when this happens. But there's, this component of it, and I don't know if you've heard much of this. We're all talking about the R naught, which is what is the transmissibility of this virus to other people.
Right.
For example, like measles has a R naught that's up like 10 or 12, something like that. So it means per one person who gets infected, 10 to 12 people could probably are likely to get infected as well. If
Wow.
we have the idea, if we can get this R naught to about 1.2, that we can really, really, really greatly reduce the spread of this illness in our communities, and therefore defeat it in the long run. So calculating what that R naught is very difficult, especially when most testing only came online at the end of February. So we were unable to really test people to the capacity that we can now to really figure out what's going on in our communities. So
And I would
really just
assume it would have to do with human behavior too. Like how much people are
totally,
interacting with each other is going to increase or decrease that, right?
which is why we made a lot of these, Gretchen Whitmer made a lot of these orders, and whether you like them or not, this can directly affect the R naught, and we're seeing it in our case investigations. Part of what the health department does is we follow up with every positive individual. If you get a positive COVID-19 test, we're calling you. If your friend gets a positive COVID-19 test and you guys are hanging out, we're going to call you too to just say, hey, you've been in contact with somebody who's been COVID-19 positive, and we'd like you to stay in quarantine, meaning you don't have any symptoms, for 14 days since the last time you saw them and you're close together. So our number of contacts, the number of people who have been in contact with our positives, has greatly reduced. It's been like on average we would have 6 to 8 people. One positive would have 6 to 8 people. Now we're seeing like 3 to 4 people that
Oh
they've
yeah.
had contact with. So that means that our R naught is going to be influenced directly by just social distancing, because you're no longer in contact with as many people throughout the day as you were 2 months ago. And now we know that there's less of a chance that people will get infected from something like COVID-19. So that's, one of the strategies is the social distancing. Obviously, there's the component we're not talking about is what happens when we start telling people that they can't go to work anymore, that they need to work from home. What happens when we cancel schools? I don't think that has been done since the
I know.
30s. World
Right.
War II maybe is when schools were actually canceled like this. So yeah, these are unprecedented times, and they didn't have e-learning back then. So we do have an advantage in some ways that we can kind of switch our gears over a little bit, do something
Yeah.
like
No, we've been very busy at the university, and all my students probably are hating life. Um, but let's we're already over. I was supposed to keep this short, but it's way too interesting. So I've got 2 more questions for you. We'll make them quick. All right. All right. You're the let's just say, for instance, you're the epidemiologist of Berrien County, right? And Berrien
that.
County, say it borders a gigantic lake, and the only place a cruise ship can dock is in the St. Joseph Harbor. But there's 200 people on there that are possibly infected or showing signs of COVID-19. As the epidemiologist, do you recommend to the leadership that they dock and you save their lives, or they don't dock and you save the lives of the people in your community?
Yeah, so this is the question. You're driving down the road, you lose control. Do you hit this person? Are those people over there? Kind of
Right.
a thing.
Right.
Uh, Either way you answer it, it's never a good solution, right? So candidly, obviously, I do the best option that's available to me.
What would you say frames the tenets that drive your ethics? This will be the last one. What are some of the main tenets that drive your ethics? As really, I mean, you're a servant to the community, which we appreciate, by the way. Um, what I mean, what is it that drives the servants of our community?
Yeah, I think that's a good question. As a public health official, this is much easier to answer than the dialyst, because part of being a community servant means you want your community to do
Sure.
well, and to prosper. So, like, what ethically motivates us that way? And man, I want to say it's more than just optimism, right?
Right.
We all
Right. Right.
see, I think, the good in people, and want them to do well and have the best life that they possibly can. And
Got it.
honestly, that is what I want in people. It's more like the coach mentality, where you see someone and you just want like success for
Sure.
them and the
Right.
individuals, or the groups of people as well. I think there is, it may be a little, but of it is hopefully not insanity, because we're trying new things and expecting different results. But a lot of the times in public health, we end up getting the same results that we had. And then overall, I think we just have hope for people to do good things and to be better people, to better themselves for that. So I always like drawing the parallel like between political divides that we have, and I think whether you're Democrat or Republican, public service is public service, and I
Sure.
actually believe you want the best thing for
Absolutely.
people.
Yeah.
However, there's just some nuances in it, but I think they get to the same picture in the same way. One is more of a societal, better the person, lift them up. One is more lift the society up so they can lift the person up kind of thing. So I think
Sure.
that ethical decision kind of happens within you. Whatever you think is the most efficient. We all think we're right, no matter what. You wouldn't have an opinion if you
Yes,
didn't
we
think it was
do.
right. So we all think we're right, and we have a solution or a way of doing something that we think is the right way to do it. And how could you ever think any different? This is the right way. But I challenge a lot of people, and I'm 30 years old now. I challenge a lot of myself too to think maybe there's another way to do this. Maybe actually what somebody has to say could add value in a different perspective to what I think. Or maybe I've heard it 100 times and this is going to be the same thing. But I do give that first part a little glimmer of hope and a little chance to say that maybe actually what this person's going to tell me is valuable. And I think it's really important to hear people out before you make these decisions. Just as I'm sure our elected officials are doing when they're making these large decisions about cruise ships or about when to close schools versus when to keep them open, or when to tell everybody in the community to stay home, or when to tell a business that they're not essential service, kind of a thing like that. So
That's a tough call. It's a tough call that even though I feel I have ethic, and being a friend of you, I would say that you have significant ethic. I'm glad as your friend and for myself that neither one of us have to make that decision, because that's just a crap decision at the end of the day.
same. So as much as we have to deal with the decisions that are made, I think sometimes it is great that other people are making them.
So then what we've determined in this interview is that it's good if somebody else has COVID and we don't. And it's good if somebody else makes all those decisions and we don't. And you don't have a die list. Those are the three things that we've walked away from this with.
Yeah, well, I would add in there too, the best vote is someone else's.
Agreed. Agreed. All right. Especially if it has sick people on it and it's off somebody else's coast also. All right.
There you go.
Guy, we're bringing it to an end. I really appreciate it.
That was good.
Pause now. This week, I'd like to thank Guy Miller and the Berrien County Health Department for being my guest. It was an insightful view into how the places become what they are, and especially how we respond to them in times of trouble. Thank you for watching another episode of Place by Design. I'd like to thank my team at Rootbound for their continued support. Of course, we also thank our generous guests that join us on the edge of the lake. Please share if you enjoyed yourself and plan to come back for more. And don't go away mad. Just go away.